Clap your hands if you know that Governor Robert Bentley is the new George Wallace of Alabama. Today we are here to make Governor Bentley do right.
Yes.
My grandfather used to say that Jim Crow is dead, but his cousins are still living. We have some new issues to address in our city, our state, and our county. My friends, we are in the middle of a silent civil war, where the casualties are our veterans, our seniors, our families, our children, our American values, and its core belief system at stake. But if it's criminal to be poor, then we're all criminals. Maybe that's why our country is building more jails than schools. The fight for Medicaid is not about race, because we see that more whites would benefit from Obamacare in the state of Alabama than blacks. You would stand up for Medicaid expansion.
Yes, you will.
I tell you that a storm is coming.
Yes.
It's a storm of righteousness. It's a storm of liberty. It's a storm of justice. But most importantly, it's a storm of good men and women who would like to see something done for the residents of Alabama.
Yes.
Shame on you, Governor Bentley. You won't get one vote from Alabama for governor unless you do right by your constituency.
Power to the people. Remember that? Power to the people. This is our shot. As long as injustice exists in the world, we cannot truly rest. The words of Nelson Mandela. There is injustice brewing in Alabama. We are asking Governor Bentley to accept expansion by December 31st. That is a deadline for us for 2014. Now, as you know, because you're here, you are knowledgeable about this subject, Governor Bentley says we cannot afford it. We cannot afford it. Okay? On this, is he right?
No.
He is dead wrong.
Dead wrong.
And I don't choose my words lightly, because you know we're talking about health insurance for 300,000 of the working poor and their family. People will die because of this decision. So let's get real. Background on this Medicaid expansion. This is coverage for the working poor. It covers people that make up to 138% of the federal poverty level. So this is a big deal. What the governor is turning away just for next year is $1.5 billion. 230 to 300,000 people will get insurance. It would be a job creator. It's all because he says it's an entitlement and we can't afford it. This is the way it works. Over 7 years, from 2014 to 2020, the federal government would pay Alabama $11.7 billion for health care. That money would spread through the economy. It would be paid to doctors, nurses, physical therapists, pharmacies. They would then go spend that money in restaurants, pay waitresses, buy cell phones, put money down on cars. Like blood going through the body, it would grow to $20 billion to $28 billion. But the reason I'm going through this exercise is this. The governor says we can't afford it. But that $20 to $28 billion is taxed by the state. And those taxes would be more than $900 million. The cost to Alabama is $771 million. What the governor has not told the people, what you did not hear on the 6 o'clock news, is that taxes are greater than the cost. The greatest advocate in the state for Medicaid expansion is Dr. David Bronner, who's head of the Alabama retirement system. So on the one hand, we have the governor who says we can't afford it. On the other, we have the individual who is responsible for state employee pensions. Now, who are you going to trust? A politician or someone who's got to it's got the back of all of Alabama state employees. So it would create 30,000 new jobs. Now, where I'm getting these numbers from is there are 2 studies out today regarding Medicaid expansion in Alabama. One is from UAB, one is from the University of Alabama. There are no other studies. So the governor has said that these studies are bogus. Okay?
Something ought to be talking about it.
But he has no other study to rely on. He just says it. And the media has really not challenged on it. This is our challenge today. We challenge the governor to debate or discuss this issue with David Bronner in prime time. I have a general question for the governor, and that is, do you actually care about us? Do you? Now, let me break it down. The hospitals of Alabama. As a result of the governor's decision, hospitals are going to go under. It's because of a perfect storm that's brewing. And that is, because of the governor's decision, our federal taxes go to other states like California to pay for their medical coverage under Medicaid, but theirs do not come into Alabama. Okay, that's one part. The other is that federal payments to the hospitals for reimbursement of indigent care is going to drop. So hospitals are going to go under. The governor's aware of it. My question to the hospitals, does the governor care about you?
No. Shame on the governor.
Apparently he does not.
No.
But he wants to give your money away to Boeing.
To those, and to those of you who are looking for jobs, does the governor care about you?
No.
He's saying no to 30,000 new jobs from Medicaid. Does he care about you? Apparently he does not.
No.
To state employees who are dependent on their pensions, does he care about you?
I don't see it.
Apparently he does not.
I don't see it.
To the working poor, to the 300,000 people that would get insurance under expanded Medicaid, does he care about you? Apparently he does not. Now, we are trying to persuade the governor to expanded Medicaid. We don't want the governor to have a legacy as a mean old man. We don't want him to have a legacy as Governor Scrooge McBentley. We don't want him to experience the ghosts of Bentley, past, present, and future. We want him to do the right thing.
Do the right thing.
Now the governor talks the talk, although he's been talking pretty poorly about the poor. I mean, he sees entitlement this, entitlement that, but he talks the talk. He carries his Bible. He says he has compassion for the poor. So you talk the talk. We're asking the governor to walk the walk. You are taking away insurance from 300,000 people. We challenge you, Governor, walk the walk. Give up your health insurance for 1 year, just 1 year. I think we know the governor's response. Bah, humbug.
But explain this to me, something I've never seen in my life. I have never seen a Republican governor refuse the advice of Republican businessmen. Republican businessmen in healthcare, Republican businessmen in managing billions of dollars of Alabama pensions and retirements have told our governor that Medicaid expansion is good business for Alabama. We make money on Medicaid expansion. Alabama is less poor because of Medicaid expansion. More taxes circulate through our economy because Medicaid expansion. The University of Alabama in Birmingham issued a report. Dr. Bentley, Governor Bentley, who is an earned medical degree, is refuting econometrics and economists on our study on the economic benefits of Medicaid expansion. I don't know where he went to medical school, but I am sure they didn't teach him that rejecting Medicaid expansion is good for the business of Alabama.
Shame on you, God. Shame on you. Shame on you.
David Bronner, one of the most respected businessmen in the state, called him out on this and said, "You are wrong, Governor. This is all part of a red state cabal of governors that want to discredit Obamacare. That's what's behind this refusal to take these Medicaid funds.
Good old boys.
I'm going to tell you that this Obamacare thing works. And what Bentley is trying to do with all the other red state governors, a lot of them, is to discredit our president and our president's wonderful plan. Now, it's got some flaws, but we're working through them. Now, I want to say a couple things about the governor. One, as a governor, he's ignoring $11 billion of Medicaid money. He's ignoring 30,000 jobs that would be created. 30,000 jobs. I see a lot of people here. I see some people here probably could use some of those jobs. $30 billion in business revenue, business income and business revenue. But more important than all of that, Governor Bentley, Dr. Bentley, you are putting at jeopardy the health care of the citizens of Alabama. Shame on you, Governor.